Hello everyone, my name is Poonam Kambe. Today I am explaining about the history of clinical trials. The world's first clinical trial is recorded in the book of Bible, Daniel in the Bible. This permanent resembling a clinical trial was not conducted by a medical but by King Nebuchadnezzar, a resourceful military leader. During his rule in Babylon, Nebuchadnezzar ordered his people to eat only meat and drink only wine, a diet he believed would keep them in sound physical condition. But several years, young men of royal blood who preferred to eat vegetables objected. The king allowed those rebels to follow a diet of legumes and water, but not for 10 days, but only for 10 days. When Nebuchadnezzar experiment ended, the vegetarian appeared better nourished than the meat eaters, so the king permitted the legumes lovers to continue their diet. This probably was one of the first time in evolution of human species that an open, uncontrolled human experiment guided a decision about public health. Then Avicenna in the Encyclopedic Canon of Medicine describes some interesting rules for testing of drugs. After that, the first clinical trial of novel therapy was conducted accidentally by the famous surgeon Ambroise Paré in 1537 while serving with the Marcel de Montaigne. He was responsible for the treatment of the battlefield wounded soldier, as the number of wounded as was high and supply of non-conventional treatment. Oil was not adequate to treat all the wounded. He had to resort an unconventional treatment. He describes at uh, length my oil lacked, and I was constrained to apply in its a digestive made of yolks of the egg, oils, roses, and turpentine. That night I could not sleep at any ease, fearing that by lack of cauterization I would find the wounded upon which I had not used the said oil dead from the poison. I raised myself early to visit them when beyond my hope. I found those to whom I applied the digestive medicament feeling but little pain, their wounds neither swollen or nor inflamed, and having slept through the night. The order to whom I had applied the boiling oil were feverish with much pain and swelling about their wounds. Then I determined never again to burn thus so cruelly the poor wounded by the arquebuses. However, it would take another 200 years before a planned control trial would be organized. In 1747, James Lane has done the very first clinical trial, then controlled clinical trial of the modern era. While working as a surgeon on a ship, was appalled by the high mortality of scurvy amongst the sailors. He planned a comparative trial of the most promising cure for scurvy. He vivid description of the trial covers the essential elements of a control trial. Lynn describes on the 20th May 1747, I selected 12 patients in the scurvy on board the Salisbury at sea. Their cases were as similar as could have them. They all in general and portrayed gums, the spots and lassitude with weakness of the knee. They lay together in one place, being a proper apartment for the sick in the forehold, and had one diet common. Although the results were clear, Lind hesitated to that was the prevention of the scurvy. He proves the lemon juice is useful for the prevention of scurvy disease. That's why he proved that. Although the results were clear, Lind's theorized 1950 was written while he was a resident in Edinburgh and a fellow of the Royal College of Physicians. Then after that, 18 arrival of placebo. It took another century before the emergence of another important milestone in the history of modern clinical trial, the placebo. The word placebo first appeared in medical literature in the early 1800 Hopper's Medical Dictionary. Then after that, however, it was only the benefit the patient. However, it was only in 1863 the United States After that, 1943, the first double-blind controlled trial